morning, and thank you so much for taking time out of your busy schedules to be here. We have a lot of progress here at Sequoia I wanted to go ahead and share. Let's see if I can get this thing working well. You can show the slides instead of me, please. There we go. So we've come a long way. You know, we've had a very interesting journey in the past 7 years, starting really with a very simple focus, which was to, I guess I don't have slides. All right. Keep going? Okay. Am I doing something wrong? Oh, there we go. Okay. And what we really realized when the company was first formed was, you know, yes, we were stewards to certain initiatives, and once we were able to successfully launch eHealth Exchange and carry quality and took stock of what Sequoia really stood for, we realized that there is an important role to play. There's an incredible amount of work that's taking place in our industry and government. But it's largely fractured. It's not really tied together into something that's cohesive and that we can implement and really take the ball and run with it. And so while there's been this progress and advancement of health IT interoperability, what we realize is that there's an untapped opportunity to bring all these activities into focus and to really harness the brain trust in our interoperability ecosystem and work together to solve specific issues. And that was really the inspiration for forming Interoperability Matters. It was recognizing matters, and I don't know if all of you are familiar with really the symbolism of the Sequoia tree and the Sequoia project, but Sequoia trees never really reach their great heights unless they are grow together. And it's because they have a very shallow root system, and they can reach their great heights when they grow together, so that becomes a very interconnected root system, and that's how it supports the great strength of that. And we really feel that that resonated with what we stand for and what we want to advance, because we believe it's going to take this entire community to work together to really hone in on what we believe matters. So we formed Interoperability Matters so that there was an organized way to hear from the community and stakeholders to prioritize the issues that we have got to fix, and that we would be able to leverage the important work of government and private sector, but stitch it together in a way that really results in a coordinated implementation approach. And because we were really formed to support the public good, that we will only focus on things that advance that cause. And so we know that there's important work that will take place, and we don't have to be involved in every single aspect of interoperability, but to the extent that there's something that would be valuable and, you know, really benefit from having a national level coordinated implementation focus, that's really what we wanted to lend our expertise in our facilitating process. So we did develop a process that will allow stakeholders to identify the issues that are really high stakes, to prioritize the things that we should focus in on. We're not a highly resourced organization, so if we're going to focus on something, it has to really matter, and it has to really, really result in something that we can start to see in our day-to-day lives and certainly in our careers, and then bring the smart people together to really focus and solve and end up with something that we can implement together. So that's really what Interoperability Matters is about. We realize we aren't able to really accomplish this alone, and so we're trying to build a community around us. So I would like, if any organization is on our leadership council or individual on our leadership council, for a member, if you would, I want to make you stand because I don't want everybody sitting. But if you're on the leadership council or if you're a member of Sequoia, would you please stand? Please stand. I know there are more of you out there. And so we thank you for really standing with us in the early days of our work when we were sort of trying to figure out what this Interoperability Matters thing could do. And it was through that active involvement that really helped us sharpen our focus, because again, there's so many things we could spend our energies on, but we really have to be very, very targeted in what we do. So we really focused in on the issues that we felt had the biggest potential where we could impact. So we started with patient matching. We did some great work with Intermountain Healthcare and others, and developing a paper with patient matching rules. We also launched our very first work group to focus on information blocking. You'll hear from them next. And they really are trying to hone in on and decode what all this information blocking means in the real world. Naturally, we're tapping into the brain trust to kind of figure this TEFCA business out. That's our newest charge. We'll talk a little bit more about that later. But I wanted to share with you today is we really felt it was important to signal the next area that we wanted to focus in on. And so we talked to stakeholders, we talked to our leadership council, we talked to the implementation community, and there was one thing, only one, that every single person said we needed to focus on that needs to be solved, and it's around data quality and having more predictable, repeatable, really consistent information. So I've said before that we're more networked than we have ever been as a country. There's more information and records being shared than ever, unprecedented. And I am proud of the progress we've all made, but we have not really provided valuable information to the clinicians and individuals that need it most, and we have to solve that. And that's something that has a universal need, and I think it's solvable. So we are forming a data quality work group in Interoperability Matters. It's important that we do this now because we are reaching a critical mass of connectivity, and I believe clinicians, I'm looking around now, I've talked to a number of you, are starting to complain mighty heavily about the lack of value. So there's a mandate, naturally. The government is mandating more exchange, but I think we all need it as patients, and we know that there's a pent-up demand and value to this. And it's interesting when you have conversations about such a nerdy topic, because let's face it, we're all kind of nerdy, and you wouldn't be here if you weren't. There is a palpable excitement and energy around really delving into this issue. So we are delighted to be launching a new data quality work group. We will be working through the charter and seeking for volunteers. This is an open call for volunteers. We want this group to be very grounded and be led by clinicians who can help us understand and prioritize and define the data that they need to take better care of all of us. And then we also want to continue the important work around information blocking as the rules are nearing completion and will be published. There's a very short time frame to really begin implementation. And so we believe this is an area where there's not a lot of understanding and perhaps not a lot of, an approach that one could pursue to implement and come into compliance with the information blocking rules. So we will be seeking others to join us in our third phase of the information blocking work group, which will focus on implementation. That means how do you take the concepts and ideas and the rules and really put them into practice to make sure that you're not inadvertently triggering noncompliance with the rule.